So it's definitely getting busier now. We're definitely feeling a sense of unnerving, the anxiety, the worry of the second wave hitting. I think we kind of had a bit of a lull period between the wave and the second wave, and we kind of felt like normality was coming back, and now all of a sudden we've kind of been hit with the second wave, and it's the shock factor of it all again, the staff anxiety, trying to keep people reassured and focused. I think we're all tired from the last wave, and reflecting back on that, we've had to try and reflect on what we did the last time, what we can do this time going forward. It's very unnerving time, very worrying time for us. So it's definitely a difference we're seeing. It's kind of like a case we felt supported and people understood where we were at in the first wave. As with this time, I'd say I feel like people don't feel like it's relatable now. I don't think they appreciate the extent of what the National Health Service is going through. And I think it's disheartening as well to see people protesting and people going against the rules and regulations, because we're definitely seeing the impact of that, what that's having on people now.
We have seen an increase in the number of patients with a confirmed diagnosis of COVID-19 pneumonia over the last 4 or 5 weeks. We have seen a steady increase in the numbers from less than 10 in sort of early to mid-September this year to over 100 this week. And some of these patients are requiring intensive care admission and treatments.
The entire situation is significantly complicated by the fact that first time round, as the government directed us all to, we stopped everything else. We emptied the hospital out, we cancelled all the operations that weren't pure emergencies, we stopped outpatients. Whereas this second wave is rolling up the beach, just at the time we are desperate to restore those urgent services and see those patients whose treatment was deferred and delayed first time round. And we were getting into our stride recovering that. We were almost back at our full levels, and in some parts we were vastly exceeding that. The complexity and the sophistication that's now demanded is vastly more complex than we faced first time round. You've just got to see some of the media pictures of town centres late at night to know that there is certainly parts of the community you go, I'm not sure I even believe this. And that is so difficult for those of us who walk in every day to care for the most critically ill patients, that we know someone sprayed hoax on the side of a town hall. But they have. So, we've worked really hard to be upfront with our community, who we are here to care for, that we need them to do their bit as well to try and manage these numbers.